Hypoparathyroidism is a rare endocrine disease characterized by the absence or insufficiency of parathyroid hormone, PTH. PTH, which is secreted by the parathyroid gland, is the major regulator of calcium phosphate balance and is essential for normal physiologic function. The secretion of PTH from the parathyroid glands is regulated by calcium-sensing receptors, CASRs, which are mainly found on parathyroid cells and in organs like the kidneys and the brain. The net result of PTH activity is to increase calcium and decrease phosphate levels in the blood, leading to normalized calcium phosphate balance. PTH activity also has an effect on cognition and helps maintain 24-hour urinary calcium excretion within the normal range. When the calcium phosphate balance is disrupted by a lack of PTH, it can lead to elevated urinary calcium excretion along with multi-organ manifestations, some of which may be life-threatening. People with hypoparathyroidism may also experience significant impacts on their physical functioning and well-being. Nearly every organ in the body is affected by the absence or insufficiency of PTH. Basal ganglia calcifications may occur in the brain with the prolonged use of pharmacologically high doses of oral calcium. Other manifestations include potentially life-threatening seizures, Parkinsonism, or dystonia. The neuropsychiatric system may also be affected, as hypoparathyroidism can cause symptoms of cognitive impairment, sometimes referred to as brain fog, anxiety, and depression. The effects of hypoparathyroidism on the cardiovascular system include hypocalcemia-associated dilated cardiomyopathy and potentially life-threatening cardiac arrhythmias. In the renal system, PTH normally acts directly on the kidney to increase calcium reabsorption into the bloodstream and to stimulate the enzymatic conversion of calcidiol to calcitriol, active vitamin D. Without the effects of PTH on the kidney, the result is hypocalcemia and hypercalciuria. Over time, nephrocalcinosis, nephrolithiasis, and chronic kidney disease may develop. These manifestations are mostly the result of treating hypoparathyroidism with pharmacologically high doses of oral calcium and calcitriol rather than the disease itself. When the conversion of calcidiol to calcitriol does not occur in the absence of PTH, it leads to reduced calcium absorption in the intestines, further contributing to the hypocalcemic state. The skeletal system is another important organ system involved in hypoparathyroidism, especially considering that 99% of calcium in the body is stored in the bone. The absence of PTH leads to abnormal bone microarchitecture and decreased bone turnover. There are several other organ systems affected by hypoparathyroidism. The absence or insufficiency of PTH in hypoparathyroidism results in multi-organ manifestations, an increased risk for complications, and significant impacts on physical functioning and well-being. Visit knowhypopara.com to discover more videos and information on hypoparathyroidism.